This video is to show you how to differentiate between ALEXIA without AGRAPHIA and ALEXIA with AGRAPHIA. Let us see what is ALEXIA. It is the inability to read. AGRAPHIA is inability to write. So the center for reading and writing is the left angular gyrus. See this patient, a young boy who had experienced CVA, ischemic stroke. On follow-up, found to have this problem. ಏನು ಬರ್ದಿದ್ಯಾ ಓದು
ಹೆಸರು
ಹೆಸರಾ
ಓದು
ಓದು ಏನು ಬರ್ದಿದ್ಯಾ ನಿನ್ನ ಹೆಸರು ಹೇಳು
ಒಂದೊಂದೇ ಹೇಳು ಬರ್ತದೆ
ನೀವು ಹೇಳ್ಬೇಡಿ ಇದೇನಿದು ಇಲ್ಲಿ ಫಸ್ಟ್ ಬರ್ದಿರೋದು ಹೇಳು ಏನಿದು ಇದು
ಬರ್ತಿಲ್ಲ ಅದು
ಬರ್ತಾ ಇಲ್ವಾ ಇದು ಯಾವುದು ಬರ್ತಿಲ್ವಾ ಇನ್ಶಿಲ್ ಏನು ನಿಂದು ಇನ್ಶಿಲ್
ಇಂಗ್ಲೀಷ್
ಇನ್ಶಿಲ್ ಬರೀ ಇವಾಗ ಬೆಂಗಳೂರು ಅಂತ ಬರೀತೀಯಾ ಬರೀ
ಹೆಬ್ಬಾಳ ಅಂತ ಬರೀ ಹೆಬ್ಬಾಳನ ಹೆಬ್ಬಾಳ.
So what is the clinical diagnosis here? What do you think the patient has? He can write, but if you ask him to write what he has written, he is not able to read. Okay, so this is called ALEXIA without AGRAPHIA. Without AGRAPHIA because he is not able to, he is able to write, but he is not able to read. So ALEXIA without AGRAPHIA. So where is the lesion here? So to understand this, you need to know what is angular gyrus and what is the connection between the angular gyrus and the Wernicke's area, and connection between angular gyrus and the occipital lobe. See, if you hear something, if I tell you to write Bengaluru, which area is activated? Wernicke area. And that Wernicke area will stimulate the angular gyrus located in the inferior part of the parietal lobe. Especially the left lobe is the one which is dominant language specific area. So we are concerned with the left angular gyrus here. So if you hear something like write Bengaluru, you will hear that word, the angular gyrus will write it down. Whereas if you see something, if you see the word Bengaluru, you can't the information has to go from the retina to the occipital cortex, and from there it has to go to the angular gyrus. So if there is a problem in the medial occipital lobe or the connection between the occipital lobe and the angular gyrus, so what will happen is patient will not be able to read whatever he has seen, but he will be able to write because the pathway between angular gyrus and the Wernicke area is intact. So there is another site for ALEXIA without AGRAPHIA, that is splenium of the corpus callosum. So there are two sites which can cause ALEXIA without AGRAPHIA. One is pure the medial occipital lobe on the left side, or the splenium of the corpus callosum, which connects the right occipital lobe with the left angular gyrus. Okay, so this is the clinical diagnosis and the final diagnosis the patient has got. So the final summary is that ALEXIA with AGRAPHIA is in a left angular gyrus lesion, because it is the common site for both reading and writing. When the angular gyrus is involved, especially left angular gyrus, patient will have both inability to write as well as read. Whereas if there is lesion in the other areas which I mentioned, there will be ALEXIA without AGRAPHIA.